Hey, I'm Jack Cush. I'm here at ACR 22 from the convention floor, right near the ACR booth, and a number of big companies, so there's a lot of activity around us. People stopping by to say hello. I'm talk today at a session called Advancing Telehealth in Rheumatology. I'm part of a grant and a 6-member panel where we gave a 1-hour presentation on why rheumatologists should be involved in telehealth. As you know, telehealth took off during the pandemic. Most of you knew nothing about it, yet overnight you became rheumatologists and became expert at telehealth. Many of you did that and are still doing that. Many of you did it for a few months until you returned to whatever your old normal was and have abandoned it. And we think that's probably a mistake. A mistake from the standpoint of patients and their needs. Not all patients need to be in your office or want to be in your office and can be safely, reliably, and effectively assessed remotely, digitally. So here are a few things. One, patient satisfaction is quite high in telehealth, especially if you look at what the doctors who are doing telehealth say. If they say good things about, and that's why they're doing it, their patients are fully on board. There are many physicians who are not on board with telehealth for a lot of reasons. The digital divide, loss of personal contact. I'm not good at tech. There's no reason for me to do this. I'm worried about losing money. Guess what? The patients of those doctors often don't really have an opinion, and that makes telehealth maybe not look so attractive. But clearly patients are involved. Secondly, what we know how and where telehealth works is in situations where it's outpatient care, of course. It's a follow-up visit in a patient who's stable or in remission, or in someone who you need to do monitoring or education or refills and check-ins. Less efficient with new patient visits. I mean, you could use telehealth to screen for new patient visits, but a new patient visit, first visit, needs to be face-to-face in clinic. It can be done by nurses, nurse practitioners, PAs, and rheumatologists. You can use validated assessment tools that don't need to be done in the clinic. A HAC score, a visual analog score, a rapid 3 score. There's a number of different things that you can do. You're worried about doing a joint exam? Well, look at YouTube and the virtual joint exam. I did a video, it's a 5-minute video, teaches you how to do this, where you basically do a 28 joint count, and you do basically inspection, contralateral comparison, range of motion. It's good at a TJC, not so good at an SJC or swollen joint count. So again, this is here because everyone has a cell phone. Everyone is potentially connected to you. Major pitfalls here are in not using the video and only doing phone. Telephone medicine is dangerous medicine. Video medicine has the capability of being equivalent to your routine care for a subset of your patients. And we're talking mainly about inflammatory arthritis patients, gout, osteoarthritis, fibromyalgia, but I've taken care of autoimmune patients, myositis and lupus remotely, and I do that by alternating my virtual visit and my face-to-face visit. Again, the challenge goes out for what you're going to do. One of the interesting presentations from Jeff Curtis in this session was on remote monitoring, remote health monitoring of patients. And Jeff laid out the new Medicare rules and CPT codes that allow you to get paid to do remote monitoring. This is a whole payment system that's totally new that I didn't know about. A lot of it's based on using a biosensor, which works in other diseases like, for instance, diabetes, where there's continuous 24/7 downloads of information that the physician reviews and then counsels and then bills for. But there's now a pathway that even rheumatologists who don't have an appropriate or best biosensor that can be used in assessing their RA or their lupus or their PSA, but there's still a pathway that you can do remote patient monitoring effectively and get paid for it. So you might want to look at that video online. It's called Advancing Telehealth in Rheumatology. I thought it was a really wonderful session. The audience thought so too, because we had about 30 minutes of questions from the audience. So tune in for more great videos from ACR 22.